Hey, good morning. I am so glad to be here with you again this morning. Thank you for making us part of your Saturday morning. Indiana crossed a threshold this week. For the first time since the start of the pandemic, there's been a shift in our state hospitals, and it's one that I think is worth noting and taking a look at, and we'll do that coming up in the 9:30 half hour. And then we're also going to be talking to a Fort Wayne woman who has stepped forward, and she is a guinea pig for the Pfizer vaccine. She actually is part of that clinical trial. And so we'll talk about how she got involved in that, what's happened, what it felt like after she got the vaccine. Does she now feel like a superwoman? You know, some of that stuff. So we'll figure out all of that as we move along. Thanksgiving now less than a week away. And, you know, a lot of families are just scaling back or closing down their celebrations all around. Some don't have the choice. They really can't have an elderly family member join them coming home from a nursing home or an assisted living or long-term care center. We're going to talk about the impact that has on them and really the impact on that industry in general. COVID has rocked their world in the senior care community. And so Chris Lundquist is with us today. She's with Cedarhurst Senior Living here in Fort Wayne. Chris, good morning.
Good morning.
What is new for family members who have a loved one in an assisted living, long-term care, or other senior center?
Well, they've just changed it again. They are highly advising that our residents do not leave the community. They want to keep them safe. Obviously, with the uptick with COVID, they are our most vulnerable, so they want them to remain in place. They've asked if they go out, and they're not saying that you can't, but they'll have to come back and quarantine for 14 days place. So, you know, that's a substantial amount of time to be in your room. So they are asking strongly that the senior population, you know, stay in place for the holiday, which is going to be tough on everybody, I'm sure.
Yeah, it sure is. Mm-hmm. So I get that. I understand why they'd have to take that step, but man, that's a huge disincentive. So what are centers doing to try and make people feel more comfortable and feel like they're part of a family?
Most of the communities are doing, and we do this every year, we have a big holiday, feast there on site, depending on what's going on in the building. All the buildings are staged at different levels based on if they have active cases in the building, if they've been exposed, what's going on. If they're at like a red level where they have exposure in the building, then what they're doing is they're bringing things to the residents in their rooms. They're still trying to keep everybody socially distanced. Obviously, the staff is wearing appropriate PPE, personal protective equipment, masks, gloves, goggles, whatever they need to do to keep themselves and the residents as safe as possible. But they're bringing around special meals. We're doing special activities that they can socially distance and still participate in. Families, they let them drop off meals. They can do visits via Zoom, via Facebook. They've done window visits when the weather is permitting. One of our buildings even put up what they call a cuddle curtain when we were able to actually come inside for visits, where it was a sheer shower curtain. They cut holes in it. You mask up and put gloves on, and then you can hug through the curtain, but it kept that protective barrier, but you could still get that somewhat of that contact. So, I know a lot of buildings, they're doing amazing things and being very creative, trying to keep the residents in contact with their loved ones.
It is so tough for folks in those facilities right now.
It is.
Yeah, your heart goes out for them. So I know you're not open yet. You're under construction right now.
Correct.
At 7210 Maysville Road, kind of in between
9210, yeah.
Thank you, 9210.
Yeah.
Kind of right between Krieger and Georgetown. Is that sort of the area there?
We are on the Maysville Circle, right by, yes, next to the AEP building.
Excellent. Okay. When do you expect that you'll be accepting residents?
We're hoping late January, 1st of February.
And when you do have folks move in, what a tough time to be relocated out of my home into a care center. I'm going to have to go through that isolation process. What is that going to look like? How are you going to accept patients?
Well, what we'll do is we'll have them, they'll have to have a COVID test, negative COVID test, 72 hours prior to moving in. And then we'll do a 5-day quarantine. But what we're doing at Cedarhurst is moving into a long-term care community is tough under normal circumstances. This makes it even harder. So we're allowing a family member to move in with them for 10 days at no charge.
That's nice.
We will feed them. That way they can help their loved one acclimate to their new surroundings, make them feel like they're not just being, put into a room and nobody be there with them around people that they're just getting to know.
Yeah.
Our residents are part of our family, and we spend a lot of time with them. We get to know them. But that first transition can be difficult. So,
Sure.
we're asking or allowing family members to come in with them. Of course, they'll have to follow the same guidelines. They'll have to be tested and then retested after the 5 days, and then they'll be able to mill around the building. Their new home.
I read a study some years ago that said that transition out of your home into a center is almost as stressful as the death of your spouse. So it's great that you're allowing a family member to come along. That's a great idea.
Absolutely. We want them to feel like this is a positive in their life, not that this is happening to them, but it's happening for them. We give them the ability to live independently and still make their own decisions. We do very person-centered care, which we'll talk about in a little bit, but it's important that they feel like this is their new home.
So memory care is one of the big elements and you are a certified memory care specialist, right?
I am.
So we're going to talk in the next segment a little bit about the differences between dementia, vascular dementia, and Alzheimer's, how they progress. If you're caring for somebody in your family, some strategies and tactics to help make that easier for everyone involved. But tell me just a little bit about how managing those patients in this COVID time is happening. I mean, my gosh, I have trouble remembering not to touch my mask and all that kind of stuff. I can't imagine in a dementia care center.
It is very difficult, obviously. So we have more eyes on our residents than probably normally do. We overstaff when possible to make sure that, we're trying to keep them busy in, socially distanced areas. We're trying to remind them to keep their mask on, but it's difficult.
Sure.
They don't want to wear their mask. I don't want to wear a mask, but that's just part of what we have to do now. So it's just that constant, reminder. They, see us wearing our masks, so they're more inclined to do that. It's just a constant reminder to them to do that, and to keep closer eyes on them, make sure that we're keeping them as safe as possible. And that's why it's really important, and why, especially in the memory care, we haven't allowed as many people in and out of there for that reason, because we want to keep the exposure to a minimum.
Is there anything different or unique about the way you're delivering memory care?
Well, we believe in person-centered care.
What does that mean?
Well, we try to get to know each resident individually. We do what we call a life story when they move in. So we speak with the family members and with the resident about their life, about what they like, what they did for a living, what their home life was like, what they enjoyed in their spare time or their personal time. We really want to get to know them, because with Alzheimer's, you lose your most recent memories first. Mm-hmm. And so if we know what makes them happy, if we know what they enjoyed, that's something that we can continue to infuse into their life to keep them as independent and keep those memories for as long as we possibly can.
One of the bizarre things about dementia is that who you were in your younger years is not at all who you may think you are now.
That is correct.
So I may have believed that I was a librarian and want to be treated as a librarian, for goodness sakes.
Sometimes, but mostly they really do go back to that. So if you were a factory worker and you work third shift your entire life, your work life, you may have been retired for 40 years, but, as you age backwards, if you will, with Alzheimer's, you're going to think that you have to get up at 11 o'clock and be at work. So you find that they're active at night. Maybe they want to sleep a lot during the day and they want to be active at night. So we have to make accommodations for that, because that is what makes them comfortable. That makes them, we need to keep them busy between the 11P and 7A, because that may have been when they worked their whole life. So that's when they feel like they need to be up and going and being productive. And if you try to fit a square peg in a round hole, and treat everybody the same. Nope, everybody's going to bed at 8 and everybody's getting up at 5 and this is what we're doing. That's just that is not the proper way to handle that. You need to accommodate their specific needs and their specific wants.
Well, we are going to be talking about some of the tactics of memory care. So if you have a family member that you're dealing with at home or just in your environment, and you have some questions about how can I be more effective in caring for a patient with Alzheimer's, dementia, and other things, that's what we're going to be talking about next. So we hope you'll join us on the phones at 800-333-1190 or 447-1190 as we continue here on the Health Call Live Radio Hour on WOWO. And we are back to Chris Lundquist. She is the executive director at Cedarhurst of Fort Wayne, a new senior living community that's opening when? Next month or next January, I should say?
Yeah, we're hoping that our first resident can move in before February 1st.
How many folks can you accommodate?
83.
Oh, okay. So nice community size without being too large and crazy. Yeah,
absolutely.
So one of the things that you specialize in is memory care, and I know you are a certified dementia care specialist. So tell me about how dementia, vascular dementia, various forms of dementia, differs from Alzheimer's when it comes to how a patient behaves.
Well, dementia is a blanket term. That is kind of like the umbrella term. Alzheimer's is a form of dementia, as is vascular dementia or Lewy body dementia. They are all different. Alzheimer's is a progressive disease where vascular dementia could be brought on by stroke, for instance. It has to do with the cutoff of blood supply. And that is obviously a more abrupt, quick onset of it. Lewy body dementia also is, you will see more behavioral issues with Lewy body. So,
and Lewy body makes reference to its an anatomy. We won't go into it, but it's a component in how your brain is built. So there's a defect in that process.
Absolutely, there is. So it is. All three are different. Obviously, Alzheimer's, number one, is the most well-known, and it is the most common form of dementia. The number one risk factor for Alzheimer's is age. Right. 85 plus. Ours is about 30% of all Alzheimer cases. And,
it was kind of interesting. You made reference to that, the Brad Pitt movie, Benjamin Buttons, and the whole idea of aging backwards. Is that really kind of the experience many Alzheimer's patients have? It
is. They lose their short-term memory first. They lose their most common experiences first. And then they will remember... they remember their old memories. That's that muscle memory. They remember if say I was a stay-at-home mother and I raised 3 kids at home. You may get to that point. Actually, I had a resident about 3 o'clock every day. She'd get very agitated, and it was because that's when she picked her kids up from the school bus. And so she thought every day at 3 o'clock she would get nervous. She would get irritable. She would wring her hands. She would try to get out of the memory care area, and we quickly deducted that it's because I have to go get my kids. Because she thought she was, in her 30s, not in her 80s, and she thought her children were going to be there at the bus stop without her. And so what we have to do is we have to divert her attention away from that. So about 2:45 every day, she loved music. So we would take her somewhere away from the door and keep her mind off of the fact that it was coming up on 3 o'clock, and we would play music and talk to her and keep her distracted from that from that feeling like she had something to do at 3 o'clock.
Yeah, I know from personal experience that distraction is just a critical technique.
Absolutely.
In general in dealing with somebody who is with dementia. And at this time of year when patterns are changing and things are changing in the home, give me some strategies and tactics for how I can better manage the holiday season for somebody in my family who might have dementia.
You can really overstimulate them. So you want it to be calming and you want it to be interactive, though. Tactile is very important, touch. But you don't want those bright flashing lights. That tends to overstimulate them and make them nervous. Not everybody. Alzheimer's, dementia, it affects everyone a little differently. It's based on their personality, their experiences, what they're doing.
So you might think you're doing everybody a favor by decorating the house and bringing out some bright, colorful things. And, won't this be fun? But it may not be.
And again, it depends on the person. But yes, you want to make sure that they're comfortable with it. Maybe add things a little at a time and see how they respond to it. Maybe do soft white lights instead of the bright, flashy color lights. Tone down the blinky lights and things like that. You have to be careful. They lose a little bit of depth perception with that too. So, bright colored carpeting or busy patterns sometimes upsets them. We take that into consideration when we're building our memory care area. It's soothing colors, it is muted tones, it is more solid patterns. We try to keep things very serene for them in those areas. But with their apartments, they all have an individual apartment. We want them to bring things with them that are familiar and that give them comfort. Pictures, things that are going to remind them of their family, things that are going to remind them of their life. If they're widowed or a widower, pictures of their spouse. We want them to keep those things close and, top of mind. We want to, make sure that we're reinforcing those memories for them.
And I have learned from experience that you just kind of have to go with it. Whatever that person believes, they're in their reality, and don't try to force where we live today upon them, because that's not where they're living.
Never. It would be like a stranger coming up to you and saying, Lee, and grabbing your arm and saying, you need to come with me, you're my husband, and you don't know who this person is. That's the kind of anxiety and the kind of fear that they may experience. So if they're saying, I want to talk to my husband. I get my husband on the phone. Where is he? Why has he left me alone? Has he divorced me? What's going on? They have these panic attacks, and their husband may have been gone for 5 years.
Sure.
So what you have to say is, didn't you remember Jim's on a business trip? He'll be back, or he's visiting so-and-so. And that's why those life stories are so important with every single person. You have to be prepared to deal with those kinds of questions, and you can never pull them into your reality. They'll never come with you. You have to live in theirs. And no matter what, my great-grandfather actually had Alzheimer's, and we moved him into a long-term care facility when he was in his late 80s. He thought the woman that lived next to him was his wife. Mm-hmm. So when my grandmother would go to visit him, he would be holding her hand. And it got very difficult for both of them, because she would say, no, Harry, I'm your wife. It's Mary. And he would not believe it.
Yeah.
So she got to the point where she visited him as a friend, because she had to live in that reality. It was very difficult for her, but it made it easier on him. So those are the kinds of concessions that, you just have to make. And that's why that person-centered care approach is so important.
Tell me very quickly, if you can, if I am going to host a gathering and I have a family member who does have dementia, what are some strategies I can use to make sure that's not too upsetting, or is the most positive it can be? Yeah,
make sure that you're not overcrowding them. Put them maybe in an area that's a little quieter. Make sure that we're still social distancing. As much as you want to hug your loved one, maybe wave to them or fist bump. I know that sounds so cold for a family member, but at this time, we have to put their safety first. Make sure that we're not inundating them. Don't put them in a loud room with, a bunch of people that are talking and yelling back and forth and kids running. Try to find them a nice, quieter place. Maybe play some nice, soft Christmas music, something soothing to them.
What do I look for as signs of growing problem or agitation? Are there visual cues?
Oh, absolutely. Wringing of their hands, pacing, maybe yelling out or acting out, rocking sometimes will happen. They'll get really fidgety and anxious. And if that happens, just find a quiet space for them. Take them into a quiet bedroom. Close the door, put on some soothing music. They're not used to all of that overstimulation. So if you take them someplace, that's unfamiliar. So if they are in a memory care area and you're taking them to a home that they may not recognize.
Sure.
So that's going to cause some anxiety, just that step. So you want to be careful once you get them home.
Hey, we have to leave it there. Time is gone. That is Chris Lundquist. She's Executive Director at Cedarhurst Senior Living here in Fort Wayne. Not open yet, but will be soon, although you are conducting tours, I understand.
Not quite yet, but
okay.
In mid-December, we should be able to do our first, what we call a Dusty Boot tour. We have to get our certificate of occupancy before we can do that. So very soon we will be doing that. So we're very excited to show off our new community.
Excellent. Thank you so much. Chris Lundquist from Cedarhurst of Fort Wayne. On the other side of this house.